Hello and welcome. Thank you so very much for coming out today. We're going to roll video in a moment, but before we do that and before it goes dark, I just wanted to officially welcome you to Zoomer Hall, to CARP, and to the launch of our Faces platform. So now we'll lights out and we'll watch a brief video.
What if we could make Canada the best place to age? We can. We have a plan that reflects the experiences of older Canadians. We call it the Faces of Canada's Seniors. Canada must ensure financial security through retirement, prevent elder abuse and keep seniors safe, support caregivers and prioritize housing for seniors, make exceptional health care a right, promote social inclusion to reduce loneliness. Together, we can make Canada the best place to age. Join us at carp.ca/faces.
Hello and welcome. My name is Wanda Morris, and I'm the Chief Advocacy and Engagement Officer here at CARP. I'm delighted to welcome you here on behalf of our President, Moses Neimer, our board, and most especially on behalf of the more than 300,000 members of CARP from coast to coast. Today, we're here to talk about advocacy, but I want to just talk briefly about some of the other wonderful things at CARP. Did you know that we have over 20 chapters from coast to coast, that we have not only our national office here, but a second office in British Columbia, in Vancouver, where I am, and also a slate of terrific benefits. We like to say that you can join CARP and do good and do well. And other programs to help us age well, such as our CARP Health 360, our electronic records program. So for those of you who don't know, CARP is a nonprofit, nonpartisan organization that advocates to improve the lives and uphold the rights of Canadians as we age. And our CARP members are actively engaged. When we polled them, 98% said they voted in the last federal election, and 98% said they intend to vote in the next one. We are a force to be reckoned with. At CARP, we've been working hard to achieve real change, often in partnership with some incredible stakeholders, many of whom are here today. Thank you. Today marks the first time we've put together this work in one place. So I'm really excited to share our National Seniors Platform with you, the Faces of Canadian Seniors. I'm going to speak briefly about how we created Faces and then turn the podium over to my colleague, Laura Tamblyn-Watts, our Chief Public Policy Officer, who will talk about its component parts. Then we'd be happy to answer any questions from you. With 1,000 Canadians turning 65 every day, it's never been more important to pay attention to this demographic. But where do we start? When we were thinking about this document, that the first place to start had to be with our members, with those 300,000 Canadians from coast to coast. And so we polled them, and included in our platform are some of the issues they care about most, like increasing funding so that wait times for diagnostic procedures and surgeries can meet targets and standards. Like increasing funding for home care so people can live in their homes with the support they need. And increasing supports for caregivers so that some of that $25 billion a year that caregivers save the healthcare system can go back to support them for their hard work. We were also informed by events so that when Sears pensioners became front page news, we were there and we're not giving up. Because even in the last year, even with everything that's happened with Sears pensioners, we still see companies paying out dividends while their obligations to shareholders, their liabilities remain unfunded. And we were informed by the tragedy of Elizabeth Wettlaufer and long-term care, the fact that 8 individuals could be murdered before, and only then was it caught when she confessed. We wonder about whether that would have happened if this had happened in a children's hospital. And we were appalled by statements like the coroner who said, "No death in long-term care is unexpected." So included in FACES are recommendations to make long-term care safer, to protect pensioners, and to make sure that Canada is indeed the best place to age. We also wanted to take advantage of current events that are happening around legislation and policy. So our platform includes recommendations for pharmacare, for consumer protection, and about access to medical aid in dying. And we wanted to speak not just to our CARP members, but to those who struggle, for those who don't have a voice. So our platform includes recommendations to help those who are low income, who are homeless, or who suffer from elder abuse or social isolation. And we didn't shy away from the issues that make so many of us fear old age, the loss of our minds, our money, our mobility. So our recommendations speak to the need to address dementia, to stop prematurely taxing investments and to start protecting them instead, and to invest in the infrastructure that will make our neighborhoods and our cities not just good for seniors, but places where all Canadians can live and work and play to their full potential. We wanted a platform that didn't just plug holes, but embraced the human potential of older Canadians. At CARP, we see a future where Canadians are valued and engaged at every stage of our lives. And when we become frail and dependent, we are not degraded. We are not denigrated. We are not warehoused in long-term care facilities, waiting for our bodies to die while our spirits are dead. But instead, accorded dignity and respect that is backed by words, by actions, and by the investments required to make those words a reality. I'd now like to invite my colleague, Laura Tamblyn-Watts, to speak to some of the specifics of our platform.
Thank you, Wanda. Thank you, everyone, for being here today. It's a wonderful opportunity to bring the voices of more than 300,000 Canadians to our stakeholders, with our stakeholders, and have the opportunity to leverage that voice at a very important political time. Today, CARP is calling on all levels of government to create a national seniors strategy. We would like to make sure that our services and the very necessities that we have as Canadians is focused to make sure that it is age inclusive and appropriate for our aging demographic. We want to make sure that it embraces the full human potential of all older Canadians. This includes a fully funded national dementia strategy, which also will have an age-inclusive lens as we look at health and care across the continuum, from home care all the way down to issues of hospice and palliative care, to make sure that at each level the needs of older Canadians are met and that dignity is restored, dignity is preserved. We want to make sure that the policy development that happens in Ottawa and at each of the capitals across this country and in our municipal organizations as well focuses in a clear and precise way on the specific needs of older Canadians as well as all Canadians across the life course. As Wanda mentioned, we have about 5 key priorities, and I wanted to take a few minutes to kind of walk you through those priorities today. We're calling it the Faces of CARP. We want to bring the faces of older Canadians into the public sphere. And I would just like to take you through what each of those aspects mean, if I may. So F is for financial security. Canadian seniors have worked hard all their lives. They've saved, they've invested, And we need to make sure that those efforts result in pension protection as well. And we know that financial security is one of the most important issues to older Canadians. In a very recent poll, we asked CARP members if they felt confident that they would have enough money and be financially secure across their aging time. A shocking 64% of respondents said that they feared that they would outlive their money and that they would live with financial insecurity, an unacceptable number. That's why we're calling on government to remove barriers and to help build supports to ensure that Canadians can live out their lives with financial security. Part of those issues Wanda highlighted before. We need to make sure that when we have pensions, that they are fully funded to begin with, so we don't end up with companies defaulting on pensions. If they're fully funded, we don't need to worry about getting in line with all of the other creditors. As Canadians have paid into pensions, Canadians deserve to get those pensions out. And as a result, we also are advocating for super priority for pensioners. So in the list of people that get the funds if a company becomes insolvent, the people who have paid into that should be and must be first in line. Second, we know that Canadians are living and working longer. We need to eliminate mandatory registered retirement income funds, which we call RRIFs, the mandatory withdrawals that exist right now, which we know will specifically help to protect the middle class. Right now, you have to withdraw your money by 71. And yet, with a lifespan increasing into our 90s and even into our hundreds, we know that that number just doesn't make sense anymore. So let's make sure that we got government know that as we are trying to age, we're not just asking for them to provide support. We want to use our own money and our own funds, but please to help us remove the barriers that makes it so challenging for older people to live financially well. We must also protect financial interests by improving customer and consumer protection for bank customers. According to a poll we did last week, 97% of member respondents agreed that Canadians need a fair and impartial banking dispute resolution system. CARP believes that financial institutions should not be able to buy their own judge. And right now, the Ombudsman for Banking Services and Investment only protects about 25% of Canadians, and more than a third of all complaints in banking are of older banking customers. A is for abuse protection. We know that as we look at questions of abuse, response, and prevention, that the numbers that we hear about elder abuse are underreported. A study in 2015, which only looked at people who are living in the community and people who had cognitive intact aspects to their ability for decision-making, said that about 1 in 10 older people will report elder abuse and neglect. We know that it's more like about 1 in 5 or 1 in 6. That is unacceptable. As we age across our life course, older people need to be able to live free from abuse and neglect, and we need this government, federally, as well as provincial and territorial governments, to invest in abuse response and protection. 2 key areas that we highlight in our Faces campaign look at making sure that people who don't know where to go and don't know what to do at least have a number to turn to. And a very specific and narrow request is for this federal government to establish a 1-800 number in order to have a person at the end of the phone help people who are calling in significant distress and to help to support to guide them to their provincial and territorial responses. Let's at least give them a place to call to find out what resources exist, although the resources are not enough. We need a national awareness campaign about elder abuse and neglect to make sure that all people know that it is unacceptable to be subject to violence, harassment, or other forms of neglect and abuse at any point, but specifically as an older person. C is for caregiving and housing supports. Why do we put those two together? Quite often, as many of our stakeholders here will know, we tend to parse out caregiving and housing into separate areas. But we know, and our older members tell us, that these are inextricably linked together. Older people want to age in place. They want to stay in their homes and in their communities. And so we want to make sure that when we're thinking about housing strategies, that we do so in ways that support people who are often providing care for 1, 2, 3, or even 4 people. They may be providing care in a sandwich generation of older adults and younger children. You may have an older person in their 70s who are providing care for a spouse and a parent in their 90s. Our generations are stretching. So we're calling on these governments, provincially, territorially, and federally, to address caregiving issues and housing issues together. We have some very specific recommendations about that, which include some tax changes, which will allow greater benefits to caregivers, and to also make sure that caregiving leaves don't require an imminent death. So if you are trying to provide support for a person who may be critically ill, it should be good enough. We know, particularly in many of our multicultural communities, and indeed many of our medical communities, that people do not feel comfortable saying, yes, I'm writing a note to say that the person that you care and you love is 6 months away from dying. What we know is that the need is real and pressing when that person becomes ill. And CARP is advocating to make sure that caregivers and people who need care have the ability to do so and the freedom to take the leave that they need. And where possible, to make sure that caregiving taxes are done in a way that people do not have to necessarily earn the income first. We know that caregiving is overwhelmingly a woman's issue. We know that 2/3 of all care is provided by women who are adult women, often caring for more than one person. And yet we know that poverty is also a gender issue. And so we want to make sure that people who are providing care don't have to drop out of the workforce, or that they can be stay-at-home parents. That the income doesn't need to be earned, that it can be an off-the-top tax. It's an easy single stroke that this federal government can do, and we hope that they take the step to reduce both the blockage and need for caregiving, but also make sure that we understand it in a gendered context. E is exceptional health care. One of the pillars of our Canadian policy, one of the things that we hold dearest to us. We know that our healthcare needs often change as we age, but our right to exceptional healthcare as Canadians does not change. Not surprisingly, there's a lot of work to be done in this area, and we detail that in our national platform. Again, while the provision of healthcare is provincial and territorial, the funding comes through the federal government, and many areas, particularly around pharmacare and vaccines and preventative public health, that's a federal area. So we encourage you to look and engage in our platform to identify the preventive, acute, chronic, and long-term care needs that we delineate in our platform. Again, reduced wait times. We have to make sure that surgeries are available for people on a triaged basis. We want to make sure that our flexible model of chronic and dementia care allows people the support and dignity that they need. And last is social inclusion. We don't stop being Canadians as we get older, and we know that social isolation and loneliness has the same negative effect as smoking 15 cigarettes a day. In a very recent study by StatsCan, we found out that the #1 predictor of well-being and health was how engaged your social networks were. And so our national platform speaks to a number of different initiatives around intergenerationalism, social connection, work-friendly age environments, and other programs that foster health and healthy activity, including making sure we all get outside where possible or engage in whatever activities allow us accessibility. Transportation is critical. And as we think across this country, we need to make sure that we're aware that our rural and remote communities have different needs than some of the communities that we have in our city centers. So when we're thinking about social engagement and social inclusion, we need to also be thinking about how people are going to get there. And is there digital literacy? And is there the internet? And is there cell service? And I tell you, our members let us know that they are not all connected to those lovely privileges that we have in urban centers. So in conclusion, our policy platform, our National Seniors Policy Platform, puts a face on the real issues of older Canadians. So we are asking all Canadians, our stakeholders, our colleagues here today and across the country to join us in trying to make sure that Canada is the very best place that we can age. A quick reminder, we are strong because of our membership. It's an opportunity to bring our voice to government, our voice to communities. I'll encourage you, your colleagues and friends, to consider joining CARP if you haven't already done so, to make sure that we bring one voice and one vote and one opportunity to allow the faces of CARP to shine across this country. Thank you very much. We'll take questions.
Good morning. My name is Ross McNaughton. I'm a retired professor of business from Ryerson University. I noticed roughly 2 years ago that the Canada Pension Plan is achieving a very impressive almost 12% return on investment since 2009. And in 2009, they were all balanced with no surplus and no deficit. So a 12% return has a huge impact on the size of the pension plan. And their target is only 6% to satisfy pension needs for the next 75 years, including your grandchildren. What that means is there's a $145 billion surplus in the Canada Pension Plan. Now, my recommendation is to not use this surplus next year, but if there is an extra surplus next year, which going at the 12% they've been getting so far would be $24 billion surplus, why not distribute it to the 6 million seniors that are under the Canada Pension Plan? And I remind you that 2 million of those people are living near the poverty line. The numbers come out such that every one of 6 million seniors would average $4,000 each more per year. Now, the government the chief actuary seems to just say, well, we're going to be really good in 75 years, not just somewhat good. But they don't seem to be doing much in terms of using this surplus to give out to Canadians. And there's a concept called generational equity. That means fairness to all, whether it's the young or the old. Now, all of us seniors, when we worked, we put our money into the Canada Pension Plan, and they've been giving us a 2.1% return on our money. In the meantime, they've been getting 12%. That is absolutely not fair, and that $145 billion that is partially ours is going to go to maybe 50 years or 10 or 20 years from now. They'll recognize, wow, we have a lot of money, maybe we should give it out. In 20 years, the math says the average surplus per pensioner will be $200,000 extra in each of our accounts if they keep going at this high return. The reason they're going to get a high return is because they can invest in public equity, private equity, real estate, anything else worldwide. I see I'm getting told to sit down. One thing the Canada Pension Plan owns is Highway 407, which most of us pay an arm and a leg to every month. And they own things like that worldwide that are very profitable that you and I can't personally invest in. Thank you very much.
Thanks very much.
Thank you. I'm really thrilled and excited to talk about an initiative that my colleagues and I are working on at the National Initiative for the Care of the Elderly. Razem Mirza is here, and Dr. Chris Klinger also is in attendance. I'm the project lead or the project coordinator for the Toronto Home Share Pilot Project, and to date we've successfully matched 11 older adults and university students, and in exchange for a reduced rent, the students provide up to 5 hours a week of support in the home. And for a lot of our home providers, that is mostly companionship, just the power of another person in their life. And we're really excited about being able to see isolation reduced amongst seniors, as well as some financial supports that they're receiving in the reduced rent. And it's also a great way for students who are transitioning to university, particularly in a large city, to be able to decrease their sense of isolation as well. My hopes and dreams, and I think collectively at the National Initiative for the Care of the Elderly, is that we can see this project expand beyond the pilot, that we can see peer-to-peer home shares or home shares with other domains as factors as well. It's leveraging the resources that we already have. I speak for the City of Toronto when I say that there's 2 million spare bedrooms in this city that are owned by privately owned homes, and about 75% of those are owned by older adults. So we have the resources in place to be able to support older adults as they age successfully in place.
Yes, my name is Robert Nelder, and today I'm wearing, I usually have 4 hats, but today I'm only wearing 1 hat. I'm with the National Seniors Advisory Council, which is a council that advises AGAL, which is a human rights organization that works on behalf of the LGBT community. I just want to give you one little example of why we need what they call cultural competency training in long-term care. There's a woman, Joan, that's not her real name. She went into long-term care. She had made her son power of attorney. She was trans, had been trans for some time. And when she had capacity, when she first went in, she wrote on a piece of paper in front of the CEO what she wanted, the dresses she wanted to wear, the blouses, how often she wanted to have her hair cut, and what style, and if she needed a shave, because that still happens sometimes. The hormones don't get rid of everything. And on her tombstone, she wanted Joan, loving mother of. When she lost capacity, her son, who had power of attorney, went in, told the workers there to take out all her dresses, blouses, the whole bit, put in men's suits, slacks, shoes, slippers, and that everybody was to start to call her him, that he was his father, and that's what he wanted. I use that example when I'm doing cultural competency education in homes, long-term care homes. And each time I get the head nodding like this, because many times when the person loses capacity, gay, straight, whatever, it's not acknowledged. And in this case, I was told by one person, we can't fight these things. So we agreed to make those changes. This sort of thing, it wiped out her identity. And this should not be happening. Thank you.
Good morning. My name is Alan Goltar. I'm from the Office of the Public Guardian and Trustee, which is part of the provincial government. We manage the finances for individuals in Ontario who are incapable of managing their own affairs and do not have a power of attorney. So unfortunately, we see the worst of the worst. We see clients who have financially been abused, financially been ignored, and are living usually in not great conditions. There are all sorts of reasons why individual family members have not taken over as power of attorney, but that's where we are. We've got approximately $1.5 billion for all of these 14,000 clients, which is a fair amount of money, and we're investing that for them. So unfortunately, when they come to us, we do see lots of cases of financial abuse. Unfortunately, maybe mostly by family members, but there are issues in the financial investment community too. So what we'd like, as you pointed out, is first of all, changes at the federal level. specifically the Tax Act, where we can help these clients out from a financial standpoint, whether it's a registered disability savings plan, whether there's other Tax Act changes that can assist them in that, but also at the financial level, where we need some much better coordination on the investment community rules, regulations, and what we can do about investment abuse, and also at the power of attorney level, where there are many abuses, many issues, and we need to work towards that. That's my story. My question is, have you had a chance to talk to Minister Tassi? And if you did, can you please tell us if there's any commitments that she made to you?
I'm delighted to say we had 2 opportunities to speak with Minister Tassi, including hosting a panel with her to celebrate and indeed kick off the National Seniors Day on October the 1st. We also hosted her again in Ottawa at the end of the day with our local chapter on Parliament Hill. Certainly, we brought the issues that you're speaking about forward and indeed spoke about both the financial and the abuse aspects with her. She was very alive to the key issues, and I was also able to share with her our deep concerns about the issues that you're raising forward, particularly around older adult abuse and neglect, and around abuse and neglect within the financial markets as well. Minister Tassi seems very alive to the issue, and she has welcomed us to further our conversations, so I feel optimistic indeed. So thank you very much. I think a closing comment, I'm going to turn it over to Wanda. We wanted to make sure that we all had an opportunity to share with you our national platform, to provide you an opportunity to engage and tell a little bit of the stories of the work that you're dealing with, and invite you to participate and to support aspects of the national platform that work with you as key stakeholders. So with no further ado, I turn it to Wanda to close our session today.
Thanks, Laura. I just wanted to take a moment to let you know that what you witnessed this morning was really a microcosm of how we built our FACES platform. So, for example, Professor McNaughton saying, as he did in correspondence to me, it's criminally unfair that 75% of top-up GIS is clawed back. That became part of our platform. To our friends who work with individuals in the LGBTQ community, to say it is not okay that somebody who has had the courage to come out of the closet ends up back there when they go into long-term care. And to our stakeholder over here who's doing some terrific work intergenerationally, we have included in our platform a commitment to intergenerational exploration, because we know the research is compelling that when generations work together, that there are benefits to both sides. So you've seen a little bit this morning of the background, and I can tell you that every one of the recommendations in our document came from our members, our stakeholders, our researchers, and I thank you so very much for that. And for being here today for this kickoff, thank you. We're delighted to circulate and talk further and answer any questions that you may have.
I think at this point, we're going to finish our formal part of our presentation and leave it open to some informal exchanges, including into our next room there as well. And so thank you again on behalf of CARP, on behalf of our board, on behalf of our president. We really appreciate working together to advance the rights of older adults, and it helps the well-being of all older Canadians as we age. Thank you, and we'll see you just outside in the reception.